Hi everyone, welcome to Reobeth Mental Health Awareness Foundation. I'm Olaide Otumba. Today I would like to discuss with us a very important topic. It's all about panic attacks. Let us look at the causes, what triggers panic attack, the symptoms, and what coping strategies in case we or anyone around us is experiencing such problem. Now, panic attacks are sudden episodes of intense fear that trigger severe physical reactions, even when there is no real danger or apparent cause. They can be overwhelming, frightening, making individuals feel as if they are dying or they are losing control of their life. So it is important for us at Reobeth Mental Health Awareness Foundation to educate our community about panic attacks. Where recently we have different cases of this, and people don't even know how to deal with it. So that is why we are doing this video, to reduce and to educate people about panic attacks, the stigma, and promoting understanding and encouraging those who are affected to seek help. What is panic attack? Panic attack is a sudden surge of intense fear or discomfort that peaks within minutes. Within a minute, it can happen to anyone. It can happen unexpectedly or be triggered by specific situations, stressor, or fears. While a panic attack itself is not life-threatening, experiencing it can be distressing, and it can affect our daily life, our daily activities. Let us look at the common symptoms of a panic attack. Panic attacks may manifest both physically and emotionally, which includes rapid heartbeat or palpitations. You can have shortness of breath, or you feeling being smothered, sweating and trembling, chest pain or discomfort, dizziness, stomach upset, numbness, chills or hot flashes, fear of losing control, or sometimes you might see that you're going crazy. A sense of detachment from reality or self. These are the common symptoms you can have or you can feel if you have a panic attack. What triggers panic attack? What can cause it? We have chronic stress, anxiety disorder, traumatic experiences, that is post-traumatic stress disorder can also cause it, phobias or specific fears, substance use or withdrawal, genetic predisposition, and some medical conditions can trigger or cause panic attack. Now, if you or someone around you is experiencing panic attack, how can you cope during this process? What do you do during the process of a panic attack? So if you or anyone around you is experiencing a panic attack, try these coping strategies. Number one, practice deep breath. Practice deep breath. Inhale slowly through your nose for 4 counts. Hold for 4 counts as well. Exhale through the mouth for another 4 counts. We also have grounding techniques, focusing on surroundings, the things you can identify around you. So I'm going to tell us about 5 things you can, the things you can do, or the things, what you can focus on around you. Number 1, identifying 5 things you can see. You can visualize the things you can see. Just try to identify 5 things you can see around you, and 4 things you can touch with your hand. 4 things you can touch around you. 3 things you can hear. What are the sounds of things you can hear? Is it someone talking? Is it a dog barking? Or, a sound of objects dropping? 2 things you can smell. So, which means you need to use all your sense organs in this case, in the grounding techniques. 2 things you can smell, and 1 thing you can taste. Number 3, use positive affirmations. Remind yourself that the panic attack is just for some time. It will pass, and you will be safe. You will be fine. So be positive. your mindset, don't let it weigh you down that this thing is not going to go. No, you need to be positive and also what, affirm positive words to yourself. Number 4, engage in progressive muscle relaxation. Tense and then slowly release different muscle groups to reduce tension. It is not all the time you're somewhere or you're on your own, you hear the sounds of some a scary sound or a scary voice and you just what, get frightened. No, you need to relax. Number 5, avoid caffeine and alcohol. Avoid caffeine and alcohol. These two substances can increase anxiety and make a panic attack more frequent. Some people do take coffee, take energy drink. These substances have a lot of caffeine in them. So if you know you are experiencing any form of panic attack or any form of heart attack, just avoid caffeine, avoid energy drink, avoid much of coffee, avoid coffee totally, and also any form of alcohol, because you see that most of the time you experience panic attack or you feel heavy chest pain. Number 6, seeking professional help. Many of us find it very difficult to talk to people, to talk to therapists who can help us when we are going through one situation or the other. Now let me tell you, if you are experiencing panic attack, professional help is very very important, because if panic attacks occur frequently and it affects your daily life, your activities, the best you can do it what is to seek professional help. It is very very important. Therapy helps. We have cognitive behavioral therapy, that is the CBT. This one helps individual experiencing panic attack to identify and change negative thoughts, to change their mindset. So it helps you to change that negative thought pattern that contributes to what, to the panic attack. But like I said earlier, panic attack is not dangerous, but no, the fear, the anxiety of I am experiencing panic attack, and the mindset that hope this thing won't, you know kill me, hope this thing won't be this, hope it won't do this to me. That alone is a trauma on its own. So cognitive behavioral therapy do help. Seek professional help. Another one is medication. You can consult your medical doctors and they will prescribe some anti-anxiety or antidepressant medications for you if necessary. Also, lastly, on the seeking professional help, join support groups. Look for support group that talk about mental health, that talk about mental illnesses, that talk about panic attack and some other form of maybe trauma, depression, anxiety and others. Find such group and what, be a member of such group. It is for your own good. It is for your own good, because in that group, in the support group, they will discuss so many form of mental illness or challenges that individuals might be going through. Panic attacks can be challenging. It can be challenging if you don't know what to do, but they are manageable with the right knowledge, with the right education, with the right coping strategies. And that is why we at Reobeth Mental Health Awareness Foundation, we are raising awareness about panic attacks, helping individuals to recognize the symptoms, seek support, and also reduce the stigma around panic attack. So if you or someone around you or someone you know is struggling with panic attack, encourage them. Encourage open conversations and professional guidance to improve their mental well-being, because the mindset alone, like I said, will what, not is the one that is what, that is damaging their life, not the panic attack itself, but what, the mindset of I am going through this and there's no one to talk to. If I talk to somebody, they will judge me. You're silent. Don't die in silence. Do not die in silence. Your life is yours to live. So let us work together to create more informed, educative, and supportive community. We at Reobeth Mental Health Foundation, we also have a support group if you would like to join us. Just contact us or WhatsApp us on +234 9051892979. Just add us on WhatsApp and we'll definitely add you to our support group for more information about what mental illnesses, either relationship, also about relationship matters, that bills, domestic violence, and so many and many more. Join us today. Bye.